Ekta, take it away.
Yes, Mr. Khorakiwala, thanks very much for joining in. First, just wanted to clarify these 9 observations that you've got. When you say critical, not critical, what do you mean by that? Can you just give us more color on what kind of observations you've got?
Yeah, as I mentioned earlier in that they are not critical. And generally there is a definition, understanding of critical, which is a showstoppers and things like that. So none of them are there, and nearly half of them we should be able to resolve it in next 15 days when we give a reply, and the balance in next few months.
Few months means?
Yeah, 2-3 months max.
Okay. Currently, this facility is approved by which other authorities?
It is already approved by the UK and the Irish authority, and we are manufacturing the products and supplying to UK and Ireland.
Okay, so you're already supplying to UK and Ireland from Shendra?
Yes.
Okay. When you talk about not critical and the fact that you'll possibly resolve a couple of these observations in the next couple of days, in the next 15 days, I'm assuming, because you're going to respond in 15 days, when do you possibly expect it to be approved by the US-FDA then?
I think that is a very difficult.
It's a difficult question, yeah.
Difficult for us to comment on it. But we do expect a resolution of this issue soon enough.
Okay. Sir, just talking about the Shendra facility, then is it safe to say that there were no data integrity issues? I don't know how it works if the facility itself is not already supplying to the US, but there was no data integrity issue that was brought up by the US-FDA?
Yes.
Okay. All right. So what about the Waluj facility? Because I heard on the conference call that you said that it's received an establishment inspection report, an EIR, from the US-FDA. When did that take place?
Oh, that came back sometime back, actually.
When is that?
I don't know exactly, but it was a month or 2 months back, actually.
Okay. So so it's fair to assume that your Waluj facility is fully functional and supplying to all regulatory markets, including the US?
No, that is not correct.
Okay.
We have not received the withdrawal of alert, but we are supplying enalapril from our Waluj facility right from the beginning.
To the US?
And that is continuing.
To the US?
To the US.
So I'm assuming that you got the establishment inspection report after the US FDA re-inspected the facility, and they said it's okay, and you've received an EIR, but the withdrawal of the import alert is not yet taken place.
That is correct.
So when do you expect that to take place?
Again, I cannot answer that question.
I understand, sir. So in my understanding, how is the Waluj facility operating for the US right now? For example, are you supplying to the US from Waluj?
Yeah, we are supplying enalapril from Waluj facility to the US.
Okay. And the UK MHRA is still not, we had a word with the UK MHRA, and they said that it was last inspected in March 2013 and that it's not yet been re-inspected, and it's currently not in compliance.
No, what we are doing is we are not, we have taken away that those 1 or 2 products which we had for UK from Waluj facility. And we are either manufacturing in L1 or other facility.
Okay. All right. So there's been a transfer of products that have taken place. What's the status with Chikalthana and US-FDA?
Same situation. After inspection, we have not heard from them, and we are initiating a dialogue, and we hope that we will have a better understanding of overall status soon enough.
Okay. Sir, just one quick question. You know, considering that Wockhardt has had so many regulatory issues in the past couple of months, or since 2013 especially, do you think that it's a prudent call for the management to possibly come out with the fact that there are some observations which have been undertaken by the US-FDA, and to clarify to investors about how severe or not the observations are? Do you think that that's something that the management can do going forward?
I don't understand the question, but what you are meaning,
more disclosures.
The way I am clarifying is appropriate, and I must say if it was not appropriate, I won't be talking.
Sure. Sure. Okay, so just a quick growth guidance in terms of the other markets. What are you expecting for India, emerging markets, as well as the other markets that you're supplying to ex-US?
Other than US market, our current year business to India, emerging market and UA collectively, we have a 20% plus growth. And we believe that this kind of level of growth we should be able to maintain.
Okay. All right. Fair enough, Mr. Khorakiwala. We're going to leave it on that note. Thank you very much for joining us and talking to us. Well, that's the word coming in from Wockhardt with particular reference to the Shendra facility. They have mentioned that the 9 observations are not critical and hence there are no data integrity issues which are on the Shendra facility by the US-FDA. It's approved by the UK MHRA as well as the Irish authorities. But and within the 9 observations, they can possibly reply to most of the 9 observations or at least half of them in the next 15 days, and the 15 days is the mandatory time that they will be replying to the US-FDA, and the remaining observations can be replied to in the next 2 to 3 months. And for the Waluj facility, they've received an establishment inspection report from the US-FDA, but currently they've not withdrawn the import alert as of now. So important.